All right, buckle up, everybody, because today we're diving deep into something really fascinating. We're talking about addiction. And guess what? It's not just about chasing pleasure, like most people think. It's actually way more about avoiding pain. And get this. Our brains have this sneaky way of tricking us into needing more and more just to feel anything at all. And that's where Dr. Anna Lembke comes in. Now, she's a psychiatrist at Stanford, runs the dual diagnosis addiction clinic there, and in her book, Dopamine Nation, she lays out some mind-blowing insights from years of working with patients.
Yeah, what's really cool about Dr. Lemke's work is that she combines, real-world experience with this deep understanding of how the brain works. So she's seeing these patterns play out in people's lives every day, but then she can actually explain the why behind them, like the neuroscience, in a way that just makes so much sense.
Okay, so let's talk about dopamine. I mean, we all know it's the feel-good chemical, right? But Dr. Lemke says that too much of it can actually backfire. How does that even work?
Well, it all boils down to how our brains adapt. Think about it like this. Imagine you're exposed to this really bright light. At first, it's super intense, but then your eyes adjust, right?
Yeah, totally.
It's the same thing with dopamine. When we're constantly bombarded with these high dopamine activities, like, drugs or social media or even junk food, our brains basically turn down the volume on their dopamine receptors.
Oh, wow. So it's like our brains get desensitized. We need a bigger and bigger hit each time to get that same feeling.
Precisely. And that's where the whole pain avoidance thing comes in. Dr. Lemke's research shows that when our baseline dopamine levels drop, we not only experience less pleasure, but we also become way more sensitive to pain, both physical and emotional. So addiction becomes less about chasing that high.
Yeah.
And more about escaping discomfort.
Whoa, that's a really powerful way to look at it. It's not just about seeking euphoria, it's about trying to avoid feeling bad. I can see how that would make breaking an addiction incredibly difficult.
Absolutely, and it really highlights why willpower alone just often isn't enough. Dr. Lemke argues that we need to tackle both sides of the equation, so to speak. So we got to reduce our exposure to those high dopamine things. But we also need to develop healthier coping mechanisms for dealing with pain and discomfort.
That makes a lot of sense. And I think this is where her whole concept of a dopamine fast comes in, right? I've heard so much about these lately, but I'm still not totally clear on what they actually involve.
When you can think of it like hitting the reset button on your brain's reward system by temporarily abstaining from those activities that trigger those super intense dopamine surges. You basically give your brain a chance to kind of recalibrate and regain its sensitivity to pleasure from more natural, healthy sources.
Okay, so in practice, what does that look like? I mean, what kind of things are we talking about giving up here?
It really varies. It totally depends on the individual and their specific triggers. For some folks, it might be cutting out social media for a while. For others, it could be abstaining from junk food, video games, or even like excessive shopping. The key is to identify those activities that, they give you that quick dopamine rush. But ultimately, they leave you feeling kind of worse in the long run.
So it's not really about deprivation, right? It's more about being mindful of our dopamine intake and making conscious choices about how we're stimulating our reward systems.
Exactly. And it's important to note that, a dopamine fast isn't like a one-size-fits-all solution. It can be a really powerful tool for some folks. But it's definitely smart to approach it with some guidance, from a professional, especially if you're dealing with, a more severe addiction. Or maybe you have some underlying mental health things going on.
Yeah, that makes sense. It's not something to just jump into blindly. But I'm curious, what about those everyday things that most of us enjoy, like watching a movie or having a glass of wine with dinner? Does Dr. Lemke consider those problematic in terms of dopamine?
Well, Dr. Lemke's all about balance. She doesn't want people to become like pleasure hermits or anything. It's more about just being aware of the potential for any activity to become a problem if it's, used to excess.
Yeah.
Or as a way to avoid dealing with some underlying issues.
So it's not about eliminating pleasure altogether. It's about understanding the role dopamine plays and making choices that support our overall well-being.
Exactly. And recognizing that, true lasting fulfillment doesn't come from chasing those quick dopamine hits. It comes from cultivating those deeper sources of joy and connection in our lives.
Yeah, that's so true. And speaking of those deeper sources of joy, Dr. Lemke observed some really interesting things about how the pandemic impacted addiction. On the one hand, you had all this isolation and stress, which, you'd think would push people towards addictive behaviors, and in a lot of cases it did. But there's this other side to the story too, right?
You're absolutely right. It was really surprising, actually. For some folks, the pandemic actually created this weird opportunity to break free from some addictive patterns.
Wait, really? How is that even possible? Wasn't everyone like stuck at home, surrounded by temptation?
Well, here's the thing. For some people, their usual triggers, things like, social pressure, or easy access to substances, or even just like constant exposure to advertising, all of a sudden those were gone. They were removed from the equation.
Wow, so without those constant cues, it was actually easier for them to resist and to, develop some healthier habits.
Exactly.
So in a way, the pandemic kind of forced a dopamine fast on some people, whether they meant to or not.
That's a great way to put it. And it really highlights how powerful our environment is in terms of influencing our behavior. Even seemingly small changes to our surroundings can have a huge impact on our ability to resist those urges.
That's fascinating. It really suggests that even if we can't, control everything about our environment, we can still make choices to create spaces that support our well-being rather than sabotaging it.
Absolutely. And that's one of the key takeaways from Dr. Lemke's work, I think. We're not powerless in the face of addiction, by understanding how our brains work, recognizing our triggers, and making conscious choices about our environment and our behaviors. We can actually regain control and create a life that's full of true, lasting fulfillment.
This has been so insightful. It's honestly shifting my whole perspective on addiction, and it's giving me so much hope that change is possible, even with all the, temptations of the modern world. But before we dive too deep into the solutions, I want to go back to something you mentioned earlier, this idea of addiction being a way to avoid pain. Dr. Lemke talks a lot about the connection between addiction and mental health, right?
Yeah, that's a huge part of her work. And it's where her expertise in dual diagnosis is so crucial. She argues that, in a lot of cases, addiction isn't actually the primary problem. It's more like a symptom of a deeper issue, like depression, anxiety, trauma, or even just chronic stress.
Yeah,
right?
It's like the addiction is a way to, self-medicate in a way, to numb those painful emotions or escape from those difficult experiences.
Right. So it's not just about like seeking that pleasure. It's about trying to find some relief from suffering, even if it's just temporary. Exactly. And that's why Dr. Lemke emphasizes the importance of, really addressing those underlying mental health issues as part of the recovery process. Because if you're only treating the addiction, but not the root cause, it's like putting a Band-Aid on a broken bone. It might provide some temporary relief, but it's not going to actually heal the underlying wound.
Yeah, that makes a lot of sense. But it also, adds another layer of complexity to the whole issue of addiction, right? Because if it's often tied to these deeper psychological wounds, it makes recovery seem even more challenging.
It can, but it also opens up this whole new realm of possibilities for healing and transformation. By addressing those underlying traumas or mental health conditions, people can often find like much deeper, more sustainable sense of recovery. It's not just about abstaining from the behavior, it's about actually healing those wounds. That led to the addiction in the first place.
So it's like taking a more holistic approach, addressing both the physical and the psychological.
Exactly. And it's important to remember that, recovery is a journey. It's not a destination. There could be, ups and downs, setbacks, triumphs, all along the way. But by focusing on, both the symptoms and the root causes, people can find a path toward a life that's free from those destructive patterns.
That's really encouraging. So we've talked about the importance of addressing mental health, but what about the more practical side of recovery? Like, what are some things people can actually do to break free from these addictive behaviors? I know Dr. Lemke has some pretty specific suggestions, right?
She does. And one of the most, I think, intriguing ones is this idea of a dopamine fast. Now, it doesn't mean like, completely abstaining from all pleasure for 30 days. It's more nuanced than that.
Yeah, you mentioned this earlier, but I'd love to hear more about what that actually looks like in practice, because it does sound a bit extreme.
It can sound that way, yeah. But it's more like invenality. Think of it like a strategic reset. Dr. Lemke suggests identifying the specific activities that trigger those really intense dopamine surges for you, and then temporarily abstaining from them for a set period of time, usually around 30 days.
Okay, so what kind of activities are we talking about here?
Well, it really depends. It's different for everyone. It depends on your specific triggers. For some people, it might be social media. For others, it could be video games, junk food, or even, shopping too much. The key is to really pinpoint those activities that give you that quick hit of dopamine, but ultimately, leave you feeling kind of empty or wanting more.
So it's about becoming aware of those patterns, those habits that have kind of hijacked our reward systems, and then making a conscious decision to break free.
Exactly. And it's not about deprivation, really. It's more about creating space for those more natural, subtle sources of pleasure to kind of reemerge. When you're constantly being bombarded with those high-intensity stimuli, your brain gets kind of desensitized to those gentler, quieter forms of joy.
Yeah, I can see that. So it's like we need to give our brains a break from all that stimulation to rediscover those simpler things that we might have been taking for granted.
Exactly. And during that break, those things that might have seemed, boring or mundane before, like spending time in nature or reading a book or having a deep conversation with a friend, those things can suddenly start to feel really rewarding again.
That's so cool how that works, but I imagine a dopamine fast can be pretty challenging, right? Especially at first. What advice does Dr. Lemke give for people who are trying to actually stick with it?
Yeah. Well, one of her biggest recommendations is to start small. Don't try to change everything overnight. Maybe just pick one or two specific triggers to focus on initially. And be patient with yourself, It takes time to rewire those neural pathways and break those old habits.
Right, it's a process, not a quick fix.
Exactly. And another important tip is to find support. Talk to a therapist or join a support group or even just ask a friend to hold you accountable. Having that external support can make a world of difference, especially when you're facing those moments of temptation.
Yeah, it's like having a coach in your corner, someone who understands what you're going through.
Exactly. And finally, Dr. Lemke emphasizes the importance of self-compassion. Addiction is not a sign of weakness, and recovery is not about being perfect. It's about being kind to yourself, recognizing that setbacks are going to happen, and learning from your experiences.
It's so easy to beat ourselves up when we struggle, right? But that just makes it harder.
Totally.
Yeah.
We need to treat ourselves with the same kindness and understanding that we would offer to a friend who's going through a tough time.
Absolutely.
And that self-compassion can make all the difference in our ability to stay resilient, to get back up when we stumble, and to keep moving forward on that path toward recovery.
I love that. Okay, so we've talked about dopamine fasts and the importance of support and self-compassion. Are there any other strategies that Dr. Lemke recommends for, rewiring our reward systems and breaking free from those addictive patterns?
There are. And one of the most powerful, but often overlooked strategies is the power of service. Dr. Lemke has observed that when people shift their focus outward, when they start focusing on helping others, it can have a huge impact on their own recovery.
That's really interesting. How does service tie into the dopamine equation? Because it doesn't seem like it would provide that same rush that you get from those addictive behaviors.
You're right, it doesn't provide that same quick hit, but it taps into a different kind of reward system, one that's based on connection, compassion, and contribution. When we help others, we still release those feel-good chemicals, but in a much healthier and more sustainable way.
Oh, I see. So it's like we're rewiring our brains to find pleasure in giving rather than just receiving.
Exactly. And there's actually research to support this. Studies have shown that acts of kindness and service can actually reduce cravings and improve overall well-being.
Wow, that's pretty amazing. It suggests that by focusing on the needs of others, we can actually start to heal ourselves.
Exactly. And it doesn't have to be anything, grand or complicated. It could be simple as volunteering at a soup kitchen, or helping an elderly neighbor with their groceries, or just offering a listening ear to a friend who's struggling.
So it's about those small, everyday acts of kindness.
Exactly. And by doing those things, we not only help others, but we also cultivate a deeper sense of purpose and meaning in our own lives, which can be so powerful in breaking free from those self-destructive patterns.
This has been such an eye-opening conversation. It's really given me a new perspective on addiction and a lot of hope for lasting change. But before we wrap up, there's one more piece of Dr. Lemke's work that I think we need to explore. The role of social media in our, modern-day dopamine struggles. I mean, we've all felt that pull of the scroll, that endless stream of notifications. But is social media really addictive? And if so, how do we break free from its grip? We're going to tackle those questions head-on in the final part of our deep dive, so stay tuned. All right, so we're back and ready to tackle a big one. Social media. I mean, it's everywhere, right?
It really is. And Dr. Lemke, she doesn't hold back. When she compares it to a digital slot machine, all those notifications, the likes, the endless scrolling, it's designed to keep us hooked. on these unpredictable little bursts of dopamine.
Yeah, and it's so easy to get sucked in. You know, you start scrolling, and suddenly an hour's gone by. It's happened to all of us.
Oh, absolutely. And it's not just about the dopamine either. Social media really taps into that, like very human need for connection and belonging. But here's the problem. It often gives us like a distorted version of those things.
Right, so we're getting these quick hits of connection, but it's not really satisfying in the long run.
Exactly. We end up comparing ourselves to these, carefully curated highlight reels, feeling envious, inadequate. It can really mess with our self-esteem and our sense of reality.
So is the answer just to, like, ditch social media altogether? I mean, it sounds like Dr. Lemke's pretty wary of it.
Well, she's definitely cautious, but she also recognizes that, social media can be a really useful tool for communication and building community. It's not about demonizing the technology itself. It's more about being aware of how it's affecting us and using it in a way that, actually benefits our well-being.
Okay, so how do we do that? How do we find that balance between staying connected and not getting, like, totally lost in the dopamine vortex?
Well, I think it starts with paying attention. Like, how do you actually feel when you're using social media? If you're noticing that it's consistently making you feel, anxious or envious or depressed, it might be time to take a step back.
Yeah, that makes sense. It's like any relationship, right? You have to check in.
Yeah.
And see if it's actually serving you.
Exactly. And sometimes that means setting some boundaries, like limiting your time on social media or being more intentional about who you follow, or even taking a break altogether.
So it's about taking control instead of letting it control us.
Right. And remembering that, real life is happening offline. Dr. Lemke talks a lot about the importance of cultivating those face-to-face connections and engaging in activities that bring us joy and finding meaning and purpose outside the digital world.
This has been such a fascinating deep dive into the world of addiction. Dr. Lemke's insights have been so helpful, and I hope they've been helpful for you too, listening out there. It's not about being perfect. It's about understanding how our brains work and making choices that support our well-being.
I completely agree. And the most important thing to remember is this: recovery is possible. You're not alone. And there are so many tools and strategies out there that can help you reclaim your life and find that true, lasting fulfillment.
So as we wrap up today, we want to leave you with this question. Knowing what you now know about dopamine and addiction, what's one small step you can take today to create a little more balance in your life? Maybe it's deleting that app that's been sucking up all your time, or maybe it's calling a friend for a real conversation. Whatever it is, remember you have the power to make a change. Thanks for joining us on this deep dive.